Hello everyone, I am Dr. Gupta. I am a cosmetic plastic surgeon working in New Delhi. So what we are talking today is about liposuction procedure, the risks, the benefits, how it is done, who are the ideal candidates. So let's start with what is liposuction procedure. In liposuction what we do is, at whatever area you want a body contouring for, we make small holes, maybe 3 to 4 mm. We first put in some fluid which melts and emulsifies the fat, and then we suck the fat out. At the end of the procedure, you can see how much fat we have removed, 2, 3, 4, 5 liters. And you see an immediate improvement in your body shape in that area where we have done. Now, what I just talked about is a classical liposuction. We as a team don't believe in classical liposuction. We don't do classical liposuction, we use technologies. So essentially there are two technologies of liposuction. One is a power assisted liposuction and one is an ultrasound assisted liposuction. Power assisted liposuction device is called micro air and ultrasound assisted liposuction device is called laser. Now both these devices are US FDA approved, and what they do is they decrease the tissue trauma during surgery. And you can imagine, if you decrease the tissue trauma, you will decrease the trauma to your nerves, so you will have less pain. You decrease the trauma to your vessels, so you will have less swelling and bruising. In all, it means you will have faster recovery. So typically all of my patients walk back home the same day evening with an improved contour, and they are back to their work, normal lifestyle, offices from the next day. Now laser, what we just talked about, has also one more advantage, that it heats the skin from inside, so the skin shrinks. So now after liposuction, once you remove the fat, you don't want your skin to be sagging. So laser helps you in that because it shrinks your skin actually. Now, who are your ideal candidates for liposuction? So liposuction is essentially a body contouring procedure and not a weight loss procedure. So anyone who has some excess fat, maybe in the face, neck, arm, breast, abdomen, thighs, buttocks, back, legs, can go for liposuction. It is not a weight loss procedure. Why? Because practically, as well as American guidelines say, you should not remove more than 10% in liters of your fat out of your total body weight in kgs. So for someone who is 60 kgs, you can only remove 6 liters of fat. Now 6 liters is not 6 kgs. 6 liters is something around 3 to 4 kgs, because understand, one is volume and one is weight. So you are using 3 to 4 kgs per session of liposuction. It's very good because you contour your body and you also lose weight, which is a secondary benefit. So it's not a procedure for someone who is like 150 or 200 kgs. Please understand this, because a lot of patients come to us and ask, I'm 200 kgs and I want a liposuction. For someone like them, it is good that they go for a bariatric surgery and not liposuction. If you are just 10 to 15% more than your ideal body weight, you want a body contouring, then you are an ideal candidate for liposuction. But not someone who is 200% or 150% more than their ideal body weight. This is what I want to explain to you. Now, the risks and the benefits. I always tell my patients, if they get it done by a good plastic surgeon, check for the qualifications of the doctors. And at a good center, the infrastructure should be good. It's an absolutely safe procedure. We take all the precautions in our OR, in our outpatient room. My nursing care is 1:1 ratio, that means one patient will have one nurse. So the recovery, the post-op management, everything is very, very good. The patient goes back home the next day. They are always thankful, and the skin shrinks with the use of laser. With use of micro air and laser, you don't have swelling and bruising, too much of it, and then you get an immediate results. What more can you ask for from a procedure, right?